My associates are not productive enough. Wow. How many times have I heard that one? My associates just are not producing. What am I supposed to do? It's a pretty common problem, so let's take a look at that and what may be causing it and just a few ideas on how to fix it. So, first thing, if you want to fix your associates, you need to think like your associates. So, let's ask the question, why are you not productive, assuming that you are now the associate? And, well, pretty much one of the first things you're going to hear is, I need more new patients. Now, this is a really interesting answer, and it may actually be true. But in order to really know if this is true or not, you're going to need some data. So hopefully you are tracking the new patient flow that your associate is seeing. How many new patients did they see last month? How many new patients are they seeing on average over the last 6 months? If the answer is 20 or above, you do not have a new patient problem. So next, we have too many cancellations and no-shows in our office, and I can't be productive. Now, this absolutely could be very, very true, and you're not going to like my answer for this one because I can shut this down immediately. The answer is have the associate call and do the verifying for their own patients. What? You're going to say, that is right. Moser, you have lost it, right? But I'm telling you, if the associate is the one that is calling the patients and doing the verifying, you will shut down cancellations and no-shows almost immediately. Now, you might be prepared to walk the walk yourself. And I do suggest, if you do have a problem with cancellations and no-shows, that even the owner doctor gets on the phone and does some of the verifying for new patients. If a patient hears on the other end of the phone, hi, this is Dr. Moser. I was just calling because I see that you have an appointment with me tomorrow as a new patient. I'm really excited to see you, and we've got all your paperwork, and I've already reviewed all that, and we will see you tomorrow at 9 o'clock. I guarantee you that your cancellations and no-shows will start to drop. I should say is that you're going to end up leaving a whole lot of messages. We know that people really don't answer their phone right now, so it's something that's super easy to do, and it will absolutely reduce cancellations and no-shows. Next, my patients have no money. Oh my God. How many times are we going to talk about this? People do not buy things based on price. We know that people buy what they value. People buy emotionally. They do not buy on facts. So you better be attaching real value to what you're suggesting that they do with their teeth if you want them to buy it. You are competing with cell phone dollars. You are competing with dollars that they want to spend on a purse. You're competing with dollars that they want to spend on a new bicycle. If you can attach real value to what you're suggesting, then people will buy it. Fixing your teeth isn't fun. So you better make sure that people understand that if they value their teeth, this is something that they need to do to keep their teeth. Train them, train them, train them. All right, next. All my patients have perfect teeth. Well, it could be. I mean, I have had a few runs where I've seen just a whole bunch of people with 28 perfect teeth. But the reality of it is the chances are is that your associate is missing things in their diagnosing. Time to sit down with them and go over the last 5 new patients that they saw and take a look at the images, take a look at the x-rays, take a look at the charting, and see if there isn't a difference in how you diagnose versus how the associate diagnoses. Now, don't be a pushy owner here and just simply say, why didn't you see that? What's wrong with you, you stupid associate? Let's go ahead and, again, try to remember what it was like when you were an associate and, go back and have these discussions with them. These are great training opportunities, and it's a pretty good idea as an owner doctor to go ahead and have a practice philosophy that you can rely on when you're going over these charts and over these images so that this is something that they can take with them forever. Simply take a look at the x-rays and images and ask the associate, what is it that you see here? When you have these discussions, you will start to uncover the areas where you just have a difference in how you and how the associate go about diagnosing. Now, this leads to another situation, which is pretty interesting. We find a lot of underdiagnosing out there with the associates, that you see class 2 lesion, but the associate actually simply diagnoses the class 1 or that big filling that you see in a tooth that you really know needs a crown and the associate is either diagnosed another filling or just kind of overlooked it completely. So what's going on here? Well, remember, COVID hasn't been that far away from a lot of these associates. And so, I feel that frankly, a lot of their educations were cut very, very short. So what we have is a lack of confidence in a lot of our young associates. Remember, dropping a box into a class 2 lesion and creating a good, healthy contact with composite resin is not easy to do. So rather than do it and do it poorly, a lot of the associates just are underdiagnosing, maybe subconsciously, because they're just afraid. They're just fearful that they're going to scratch that other tooth or that contact's going to be open and the patient's just going to complain over and over again. Same thing with crown preps. It's not easy work getting solid margins that either you can scan or pick up an impression. Packing retraction cord, making provisional restorations is not easy. So a lot of times these young associates, rather than get involved in something like that, are just not doing it. So invest in your associates, help them, train them. There's lots of great ways to train young associates, but invest in them, get them the CE, have them sit down at the chair, assist when you're doing dentistry. These are great ways to train your associate. And you know what? I mean, once you've done this and once you've invested in them a little bit, you've got a friend for life. You've got an associate who will always look up to you. You'll always be their mentor, even if they don't stay with you forever. Lastly, have more data. You're going to need data that shows dollars treatment plan per new patient and dollars treatment plan per patient seen in ReCare. Why? Well, look, it's data. I mean, it's important. We need to be able to compare apples to apples. We're not saying it's all about the money. So when your associate gets all crazy and says the only thing you worry about is money, say, no, that's just not true. It's just like speed for a race car driver. Speed is something that they can measure. Speed is something that they will put up there as a metric and say this driver is going faster than the other driver. But the reality of it is that the driver can't get the car across the finish line in one piece. It doesn't matter how fast or how slow they're going. It's just a number. It's just a way to give us some opportunity to do some comparison. Just don't make a big deal out of the number. It is what it is, and it's just something that has to be compared. And I guess this is worth pointing out. Let's say you do have one of those great clinicians for an associate, and their dollars per treatment plan is what is comparable to what yours is, but they're just still sitting around a whole lot. Well, this probably is a patient number situation. They probably are not seeing enough patients. So I think you're going to have to ask yourself the really hard question is, hey, do you really actually even need an associate? Maybe you really don't. Maybe you should be seeing these patients yourself. I hope this video has helped you in some way.